For years, ordinary Iraqis have struggled to find adequate health care due to the country's crumbling hospitals. And then the pandemic hit, making the situation desperate.
In Iraq, we have around 900 intensive care units. Right now, we have more than 500 patients in these units, meaning more than half of ICU are occupied. If the number of patients increase, God forbid, the health institutions will not be able to absorb this number.
Some say the government's response to the pandemic is to blame.
The deterioration of the health situation in Iraq after the repercussions of corona is due to two sensitive successive stages. The first of which is the government measures accompanying corona, which has failed to close the borders with countries that record high infection accompanied by a decline in the level of the health sector.
Relief agencies say the health system has been in steady decline since the US invasion in 2003. They say Iraq currently needs 2,500 hospitals to meet the needs of the population, but only 250 are currently operating. Many facilities damaged in the first few years of intense fighting are still waiting to be repaired or rebuilt. Iraqis say that's primarily due to mismanagement and corruption.
The Iraq government has injected hundreds of millions of dollars in this sector alone since 2003 until now, but you cannot see this money reflects on the services provided to the Iraqi people simply because of the corruption that dominates this sector and also with the other sectors in Iraq.
For medical workers trying to cope with the pandemic, it's a desperate struggle. Iraq is one of the worst affected countries in the Middle East and is currently battling a severe third wave of infections. Relief agencies are now asking for urgent aid from overseas and demanding that the Iraqi government dedicate what resources it has to saving lives. Shoaib Hassan, TRT World.